Good evening. Everyone has found some need for health care. The elderly need routine daily medications, pregnant women need prenatal care, and children need vaccinations. For yourself, you probably had seasonal allergies, needed a flu shot, or maybe suffered from more serious illnesses like cancer or needed surgery. All these health care spending is expected to reach over $4 trillion this year. Someone has to pay for it, either the government, employers, taxpayers, or you. Imagine if you couldn't afford health care or didn't qualify for Medicaid or Medicare. How would you pay for your doctor's visits? How would you be faced with the challenges of bypassing necessary health care or stacking up costly medical bills? The November-December issue of the nation's health states, according to the U.S. Census Bureau, over 270 million Americans were uninsured in 2013, while over 40 million were uninsured. And those millions of uninsured are paying tax penalties for not even having health insurance coverage. I've experienced several facets of this debate myself, from being self-employed to having high deductibles and a lot of out-of-cost pocket expenses for my wife's pregnancy. Every day I see the benefits of a universal healthcare system, not only for myself, but millions of Americans who are in similar situations. Universal healthcare systems are being utilized all over the world, and the U.S. can create a similar system. Healthcare will be more accessible, more efficient, and offer equality for everyone, regardless of economic or income status. Success is based on several related factors. Factors include who is covered, what services are covered, and how those services are being covered. On September 2012, September 8th, an article from The Lancet states that pool financing can greatly improve the utilization of equity, productivity, and effectiveness for insurance, compared to other systems where patients are responsible for their own health costs. Historical data shows countries have attained a successful universal health care system. Achievements have been through countries that have happened over a span of a time frame, although many countries are achieving a system more quickly. It takes everyone's involvement, not just the government. There are concerns and issues regarding health spending, but all have solutions. The Commonwealth Health Fund system is at less than 70% in 6 different categories. U.S. ranked last for the 47 million uninsured who don't have readily accessible health coverages. Regardless, changes are needed in these areas to improve our ranking. Now the cost of healthcare spending is rising at a fast rate, so implementation of a new system is crucial. People with large medical bills are often disabled or poor. Without constant proper care, they are costing government programs more money because of they are sick longer. The January 1st, 2008 article from the Annals of Internal Medicine reports that by 2015, healthcare spending is expected to reach $4 trillion. With the rise of healthcare spending, there are several resources for financing healthcare reform in the U.S. according to the 2009 July 2nd issue of the New England Medical Journal. Possible resources include reduce existing government spending, increase taxation, or by limiting expenditures on employer-sponsored programs. These employer tax exclusions amount to cover over $250 billion per year, and they can be used towards the healthcare reform. Today I've explored the different benefits and options for creating a successful and efficient universal healthcare system in the United States. From my own experiences, as one of the many Americans dealing with a flawed health care reform, I see the benefits and advantages of universal health care system. If everyone had the same attitude and positivity towards a new system, we can all benefit and have access to necessary health care without a financial burden. Let me show you the chart. The mortality applicable to health care when it comes to U.S. rankings, out of 16 different countries, the U.S. ranked last at 115%. The National Scorecard in 2011 said preventable deaths, there were over 96% of deaths in the United States that could have been prevented if it was for preventive health services that were available through a United Healthcare system. Also, health insurance waste costs as in ranking in countries, United States ranked one of the worst countries in this planet for 7% of wasted spending. In Medicare savings alone, we wasted over $618 billion in healthcare spending. And this concludes my presentation this season on healthcare reform. Hopefully you can take this information and make it more valuable to you, and you can see why our country needs a universal healthcare system. Thank you.